Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing no new cases of COVID-19. The total remains at 250. As of this morning, 8 individuals are hospitalized, of that 4 are in intensive care. 132 individuals are listed as recovered. There are 113 active cases. Yesterday, CADM Provincial Lab performed 508 tests, bringing the total to 18,856. Today, we've seen more individuals listed as recovered as active cases for the first time. This is thanks to the efforts of Manitobans for staying home, for practicing social distancing. We've seen likely some benefits from our collective work. Again, we need to be cautious that this does not mean our risk is reduced. The virus is still in Manitoba. We still need to continue our efforts at social distancing and continue to follow these numbers closely. This is why we extended the public health orders. This is why we've put measures in place to reduce the importation of the virus. The Quarantine Act measures have been in place. The public health orders announced yesterday now require the 14-day self-isolation with even interprovincial travel. We need to protect those at increased risk of infection, and that was a major driver behind the orders yesterday to limit non-essential travel to the north. We have many measures in place to protect those living in personal care homes, and we are moving forward with measures to ensure those employees at personal care homes will have only one place of employment. There's a clarification to yesterday's bulletin. Appliance stores and furniture stores that sell appliances may remain open to the public. I'm reminding Manitobans to cancel all non-essential personal travel. This virus is in all regions of Manitoba, so all Manitobans need to make efforts right now to stay home as much as you can. If you go out for necessary reasons, ensure you are practicing social distancing at all times, washing hands at all times. There's been some comment in other jurisdictions as well as here about the driveway parties. Certainly enjoying nicer weather out in your yard with your family, taking walks with your family, ensuring that you're able to maintain the social distancing, that 2 meters from other individuals is the safest way to act at this point. It's best not to invite neighbors over to your place. We want to ensure the ability to keep that physical distancing from others at this time. Certainly do connect virtually with others. Stay connected with your loved ones. There's been some concerns raised about counterfeit personal protective equipment in the marketplace. I want everyone to exercise caution when making such purchases. The appropriateness of such devices can't be clarified. Remember that the best way to protect yourself is to stay home, and that's especially important if you're ill, even with mild symptoms. Wash your hands frequently, cover your coughs and sneezes. If you do go out, ensure you're maintaining that physical distancing. In times when that may not be possible, cloth masks, homemade masks are certainly acceptable, but do not allow them to change our efforts. Continue to stay home as much as you can, and remember that wearing those masks don't protect the person wearing them, it protects the person around them. Continue to access credible information. Visit our website, manitoba.ca COVID-19, for up-to-date information. The recent numbers in Manitoba are showing that we were never helpless against this virus, that we put measures into place and all Manitobans stepped up to help limit the spread of this virus. And so while these numbers we should be cautiously optimistic to see the numbers of this last week. It is too soon for us to let up on our efforts to continue to interrupt the spread of this virus. Washing your hands frequently, staying home as much as you can, physical distancing at all times, but do remember that our healthcare facilities are safe. If you need to access healthcare, please do. Call HealthLinks if you're unsure. Call your healthcare provider. Stay in touch with your healthcare provider. A lot of services can be done virtually, but if you're in need of urgent or emergent medical services, they are available and they are safe. So please do not hesitate to access medical care at this point. So again, thanks to all Manitobans, thanks to our healthcare workers on the front line, truly heroes, keeping Manitobans safe, and I'll pass that over to Lanette now.
Thank you. Good afternoon. I want to begin today by thanking Bell MTS, which announced today it is donating $1.5 million $1.5 million N95 respirators to healthcare systems across the province. For Manitoba specifically, we've been told approximately 70,000 of those N95 respirators will be coming our way. So this is wonderful news, and on behalf of all frontline health workers across Manitoba, thank you very much for your contribution. This donation from Bell MTS adds to the considerable generosity we've seen from local businesses and organizations over the past few weeks. Since putting out our call for donation of PPE at the beginning of the month, we've received thousands of masks and gowns and gloves, and we knew that we were all in it together when we started, and it is great to see this. We're so thankful from the teamwork that has come from the community and extended all the way to our healthcare workers. These donations are really important, and we thank all of you who've donated. We continue to accept donations for N95 respirators, for medical procedure masks, medical examination gloves, disposable gowns, disinfectants, and cleaners. All supplies must be in their original packaging, and the addresses and hours of operation for the drop-off locations can be found online. With regards to PPE, ensuring the health and safety of our frontline workers and those engaged in other high-risk occupational settings is a fundamental priority in Manitoba's response to COVID-19. And in order to care for our patients, our clients, our residents, we must protect our healthcare workers. So we are taking every available and appropriate step to protect our workforce from exposure to COVID-19 so that they are able to care for the sick and the vulnerable population, the Manitobans, over the coming weeks and months and for the duration of this pandemic. We have taken a number of steps to do this by limiting the opportunity for the spread of this virus in healthcare settings. And this has involved screening of patients and clients and residents and staff for symptoms. It's also included restricting visitors and limiting access points into different healthcare facilities. It's involved educating staff and community about the importance of proper hand washing and physical distancing, which is really our best defense against COVID-19. So now we are we are in the process of looking at what other jurisdictions have done to further protect our most vulnerable patients. And this includes steps to limit the number of healthcare facilities in which our healthcare workers are at, therefore minimizing the risk of exposure across multiple settings. So these are not easy discussions, and they are not easy to implement operationally, but they are vital to ensuring the protection of our most vulnerable patients. So we are beginning those discussions later today with union representatives for our workers, and we'll continue to provide updates as things progress. Across Manitoba, PPE is a supplement to the efforts that we are making to protect Manitobans. We are in a very different place in this fight than other jurisdictions, but it's also a benefit to us because we are learning from them, and as every day goes by, more evidence is available and emerging. But like other countries and other provinces, Manitoba's supply of PPE is impacted by the same disruption of supply, production, and distribution. So we really need to prepare now for the duration of the pandemic and the surges that still may come down the road. So we're taking every possible step to ensure appropriate protection remains available to those staff in high-risk settings and situations. Appropriate use now will conserve supplies that we need for later. And this is a very fluid situation, and we're monitoring our supply, our use, and our orders by the hour and the day. Our supply levels continue to change depending on the areas of need and the timing of deliveries. And we are closely monitoring appropriateness of use and will be reevaluating recommended PPE strategies in various settings depending on risk level. So we are doing everything possible to make sure Manitoba has the supplies that our staff need when they need them. We are buying what we can, when we can, while always ensuring our supplies are safe and appropriate for use. We are conserving our supply by educating staff on the importance of hand hygiene, by limiting the services that we can safely postpone or do so by phone or video. And we are encouraging patients and clients and residents to wear non-medical masks when they attend healthcare appointments. We are preserving our supply by safely extending our use of PPE where it's safe, and by sterilizing and reusing equipment that can be used again. And if there are supplies that we can make closer to home, we are working with our clinical experts, our infection prevention and control, and staff health, as well as governments and businesses to create Manitoba solutions like the reusable N95 respirators. So we had mentioned this before. Dr. Christian Petropoulos and William Turk and their team have been working around the clock to develop these reusable N95 masks for use of by healthcare workers. The goal is to use this innovation to reduce our demand for the traditional one-time use N95s. This is going to continue to be a very fluid situation, but we are learning from other jurisdictions that have been in this position before us, and we are consulting with our experts, and we are going to continue to monitor and audit our use to ensure that we are conserving supplies to protect our workforce and keep critical services available. And with that, we can open it up to questions.
Thank you. A reminder to our reporters online, one opening question and one follow-up. And please reintroduce yourselves. From the Canadian Press, Steve.
Oh, hi, Steve Lambert from the Canadian Press. Dr. Roussin, you touched on the driveway parties. Anecdotally, I've seen a few very small gatherings on driveways in my neighborhood, and now we're getting to that warm part of spring where people don't have to put on parkas to go outside. So I'm wondering if you could clarify. It sounds like you discourage such gatherings, even in small amounts, people under 10. Is that correct?
Yeah, so it's all about the messaging, and so when we talk about messaging, it's easy to state. It's safest to stay home, safest to stay with the people who live in your home. If you're out on your own driveway in your backyard, going for a walk with your family members, this is all great. Keeping that physical distancing. But you know, Manitobans, it looks like Manitobans have been adhering to a lot of our advice, and we've been looking at some good numbers for the last few days here, again, cautiously optimistic. And so if you had a few people over, if you were able to have that physical distancing outside, then this is certainly reducing the risk. But again, all of these scenarios are difficult to give specific advice for every possible eventuality. So if it starts getting up at 10, then it's more difficult to maintain that social distancing. So the advice is, for the most part, stay home, stay near your home, certainly enjoy the outdoors, but try to do whatever you can to ensure that you have that physical distancing.
Thank you. My follow-up is from Ms. Siragusa. Are there any problems with the supplies of things like gloves? And the reason I ask is because Shared Health has posted advertisements for some support positions at testing sites, screeners and the like. And they mentioned that the PPE required and supplied will be a hazard vest, the mask, the eye protection, etc. But it specifically mentions no gloves. Mm-hmm. And I'm wondering, is that because people in support positions do not require gloves according to health guidelines, or is it to conserve gloves to make sure they're there down the road and for other workers?
Mm-hmm. That's a good question, Steve. So gloves, we use a high volume of gloves at the best of times, but we do go through provincially a lot of gloves. And right now we're looking, we have been supplying not just the health system, but also other community areas. So for sure we go through a high volume of gloves. We also have received a good shipment of gloves, but as mentioned before, that it's day by day, week by week. We don't necessarily want to rely on outside sources to provide us with those gloves just because it's a tenuous situation. So we will, of course, provide gloves to whoever needs gloves based on the situation, based on the risk, and make sure that they get those supplies.
From CTV Winnipeg, Michelle.
Hi, it's Michelle Gerwing from CTV Winnipeg. I wanted to know why is a day where we have more recovered than active cases so important in the trajectory of the outbreak in the province?
I think it's just one more measure showing that the rate of growth of the infection is being surpassed by the rate of recovery. So just another indicator that we see there. So typically we'll find the recoveries are coming about 14 days after symptom onset. And so as our number of new cases decrease, we'll expect that increase in recovered. And this was the day where we actually crossed over, where we have more people listed as recovered as active cases.
Okay, and I have another question, this one probably for Lanette. So if family members are now providing home care to loved ones because of temporary cancellation to some services, can you explain how scaling back those services is actually helping contain the spread of COVID-19? So is it mainly to prevent transmission through staff or preserving PPE? Can you just shed some light on that?
Yeah, it's really an operational decision based on the needs of the client and the supports that are available. It could be because of staffing, it could be because of PPE, and it is most definitely meant to be temporary. So it's not a must do, it's a what is the situation in an individual organization, like a region, local area, and what can we do? And we are looking at that. I mean, we've done that with diagnostics, we've done that with surgery. So it's really just trying to conserve and preserve both our staff and our PPE at this time.
From the Winnipeg Free Press, Carol.
Hi, it's Carol Sanders at the Free Press. I have a question for Dr. Roussin. Dr. Roussin, can you please tell us what the R0 rate is in Manitoba right now and how that compares to where we were at 2 weeks ago and what it's projected to be at the end of the present during the current health order?
Mm-hmm. Yeah, so it's a good question. So the R naught, the basic reproductive number, is really a theoretical number. This is the average amount of people that would be infected by a single case in a susceptible population. So it's a tough thing to calculate. It's more of a theoretical number. So you saw that our secondary attack rate looks to be about 9%. So that's a number of close contacts that become infected. So that we know is about 9%. The R naught is an estimate, and when we look at some of our modeling and things, we find that R naught around 2.5, 2.6.
And given that R naught, what will it need to be at before you can really significantly ease up on the restrictions or the orders?
Right. So the R naught is the initial rate, and then so later on, the R number will change over time as there's less people that are susceptible to it. So really, if you're looking at an epidemic, once you have the R value under 1, then the epidemic goes away, right? And an R number over 1 is a propagated infection. So all of these measures here are to decrease the R value to under 1.
From Global, Marnie.
Good afternoon, Marnie Blunt from Global News. Dr. Roussin, my question is related to cottager travel. You've been clear that people should stay home as much as they possibly can, but some people are thinking that they can go to the lake, avoid businesses and other people, and if they feel sick, drive back to Winnipeg right away or the next day. Can you talk about why people should or shouldn't do that, and also how quickly symptoms of COVID-19 can set in?
Right. So the basic messaging is like we've always been said, is stay home for the most part. Only go for necessities. Some people are going to, with the nicer weather, going to want to go out to the cabin. And so if you do, it's to go directly, to not stop off, not do shopping in local towns, not use healthcare services in the smaller areas unless absolutely necessary, maintain that physical distancing, washing hands at all times. So these are the messages here. So it's really to not leave any trace of your visit, essentially. So if you must go, it's limit contact with all others, and then come back straight. And how quickly can symptoms come on? Well, I mean, most people have mild symptoms with COVID-19, certainly at the beginning, and 80% of people can recover at home. So just like any illness, you can start developing symptoms at any time. So if that occurs, then you have to be extra cautious, and it would be if you were out someplace, it'd be advised to come home directly, maintaining that physical distancing.
Thank you. And my second question might cross over with Carol's a bit. I couldn't quite hear her question. But other provinces have been releasing their best and worst case scenario projections. When will we see those in Manitoba, and or where are we at in getting those projections?
Yeah, we have been working on some models. We are, up to 6 weeks behind in our trajectory compared to some other provinces. So it's going to take a bit of time for us to have some good numbers. All the modeling depends on having valuable data to enter into it. So our numbers have been still early. So we're working on that. A time frame I don't necessarily have, but we're going to work to try to get something out to Manitobans to show them a few different modeling scenarios.
From the Brandon Sun, Bud.
Hello, Bud Robertson, the Brandon Sun. Lanette, there has been talk of volunteers coming into Fund roles. Has that included volunteering to personal care homes to show up staff there so they can stay in one place?
Yeah, no, that's a great question. So volunteers are very much appreciated, and you're exactly right. We need to put them in a place where there's some consistency. So as we look at limiting the amount of flow of people through the personal care homes, we certainly would value volunteers, but we do need that consistency. Same with students have been coming in and supporting the efforts. All good. We don't want to stop that. We just want to make sure that people There's just not a lot of different people coming in and potentially introducing the virus in a high-risk population. So certainly, and with regards to home care too, when we talk about light housekeeping and meal preparation, you know, if there's alternatives like Meals on Wheels or supporting a neighbor, like those are all great things we should look at where there's opportunities to do that.
Okay, good. And Dr. Roussin, I've heard some experts talk about 28 days self-isolation period as opposed to 14 in the event that the virus returns, and they've seen some of that. What are your thoughts on 28 days self-isolation?
As of right now, we're still looking at the incubation period is somewhere less than 14 days. We have a 14 days on as a safety factor. And so certainly a person who is a contact of a case or coming from a place with a higher incidence, they're going to self-isolate for 14 days, and it's almost everyone would develop symptoms within that 14-day period, and you know, almost everyone quite a bit earlier than that. The other aspect of that is a case. So a case who's recovered, no symptoms, and it's more than 14 days since their symptom onset, we would consider them recovered. A few of the things that are confusing there is that even on cases that are fully recovered, you can sometimes detect a positive PCR test, the molecular test that we do for weeks afterwards, but that's not showing viable virus. That's just showing remains of the virus, the genetic material of the virus. So that 14 days is where we're sticking right now.
JOB, Diana.
Good afternoon, Diana from 680 CJOB. Question for Ms. Siragusa. With regards to your statement on PPE, we've heard concerns about the availability of PPE from the Health Minister yesterday on CJOB, from Doctors Manitoba, and from unions. Obviously, you mentioned the donation of the N95s, which is helpful. But obviously, you're still having to make some tough decisions right now, and I'm hoping you can kind of explain a bit more who's getting that PPE right now and who is not.
Yeah, that's great. So the highest risk population in terms of staff protection is people who work in emergency response and people who work in the hospital facilities, because they don't know who's coming in, what their history is. They may be symptomatic, but they are the ones who have to do the tests. And sometimes it's an emergent, like rushed, high-risk situation. So those people have received their PPE. The other high-risk population is the long-term care facilities, and not because it's a high-risk environment necessarily. It is the home for our seniors, but they themselves are a high-risk population because of age and chronic disease. So the risk there is that people would introduce that into the long-term care facility. So it's a little bit different approach to spreading the virus, but the long-term care facilities also have received their PPE. So part of it is it's been distributed, but it's been distributed from the central warehouse to the regions. That has to get out to the individuals. So I understand that's happening now. And then there's other lower risk situations. So we haven't really seen a lot of community spread. That doesn't mean that it's not out there and it's not possible and a potential, but there are things in place for other healthcare workers with lower risk population or lower risk environments where they can screen ahead of time. Social distancing is effective. Washing their hands is effective. So they still need PPE, but they probably don't need the same degree of PPE as, say, a critical care nurse in ICU. So it's really looking at all those different scenarios, risk, environments, and making sure that we have the guidance so that people use PPE appropriately. So it continues to be shipped out and distributed. We're working with the regions to make sure that it's secure. That's the other thing. We do keep hearing that there's theft or hoarding. So we just need to make sure that the supply gets to where it needs to go and that it's used appropriately based on the risk of the environment, the setting, or the patient.
Thank Thank you. And then just as a follow-up, does the fact that we have fewer active cases here in Manitoba compared to other jurisdictions, say Ontario and Quebec, does that factor into who gets PPE here in terms of the federal distribution?
Yeah, well, that's a really good question. I don't sit at any federal table, so I can't tell you how they determine what goes where and what volumes. But yeah, you know, when we were just talking about this earlier, that when you watch the news and you see 250 deaths in Quebec and 1,000 new cases in a day, you would think that they need more supplies than us potentially, but that doesn't mean that we don't need supplies. We do, but the urgency is different, obviously, to the east, to the west, to the south of us. So you know what? Our goal is to keep working with vendors. We're going to explore every avenue. And we are looking at those alternatives, and we're looking at those basic infection prevention and control principles. Like, those really are key, and people can't forget, like, your skin actually acts as a barrier. So if the virus gets on your skin, that doesn't mean it's in your body. It means you have to wash your hands. So like, there's things you can do. Obviously, there's higher risk situations where you would want your PPE, but yeah, I don't know how the federal government determines how much they're sending where, but certainly we have made the request. We'll continue to advocate for all Manitobans.
From the Winnipeg Sun, Scott.
It's Scott Belch here, Winnipeg Sun. Excuse me. I just wanted to go back to Steve's question on. I'm just not sure if we got a clear answer. Is there a glove shortage, and where are PPEs in terms of supply lacking at the moment?
So we're looking at 2 weeks at a time. That's basically how we're planning this, because we don't want to depend on shipments that we expect coming that don't come. So for the next 2 weeks, I would say we are good with supplies, and we are going to continue to pursue more, and gloves specifically. We received quite a large shipment actually last week, but it's just a matter of keeping that going.
Okay, and my follow-up is for Dr. Roussin. Just going back to yesterday, and I was trying to wrap my head around this 50-kilometer buffer zone into northwestern Ontario, which includes a lot of cabins. And the messaging has strongly been a recommendation of not going to cottages and that sort of thing, and because of the possibility of people stopping and whatever along the way. And so why have a 50-kilometer buffer zone there, which would, at least to me, would seem to at least leave the door open for those thinking of going to the cottage to go there because that's in place, instead of having that re-entry 14-day isolation period.
Right, so I mean, one of the biggest considerations with that buffer zone is that there's a number of neighboring communities that essentially there's no real border between them, that people go daily for routine travel, and so wouldn't be feasible to have people in those situations to self-isolate every 14 days every time they go, and a lot of times it's just a daily occurrence. So we have to put in some leeway for that. And then certainly we discourage going to the cabins, to the cottages. It's best to stay home right now. We have some advice on if you do go, we've articulated that. But we really put that buffer in because we know that there's a lot of cross-border travel in neighboring communities, and we have to find a way to address that.
From CBC Radio Canada, Mohammed.
Hello, it's Mohammed from Radio Canada. It's maybe a silly question, but I would ask if person who is recovered could be reinfected again, and do you advise people who are recovered to follow the rule of social distancing and isolation?
So it's a good question, and it's early. We don't necessarily know the answer to that for sure. This is where those serologic testing is going to come in play. So we know that there's a number of endemic coronaviruses that we have every year in Manitoba that cause cold-like symptoms, flu-like symptoms. To those, many people do develop immunity to it. So the assumption right now is that people who recover from infection are likely immune, at least in the short term, but we don't have documented evidence of that as of yet. So certainly as we are right now, recovered people would be still advised to practice a social distancing that everyone else does at this time. And so that's maintaining that 2-meter separation, staying home as much as they can, frequent hand washing, because not only does that protect against COVID, protects against many circulating viruses as well. So that's where we're at now, and we hope to know more as soon as we start getting more serologic testing done.
Thank you very much. And as a follow-up, I was wondering, maybe you've answered that earlier, but when would the Manitoba could say that he has beaten this virus? Do you have modeling about that?
When we would label a person, or when Manitoba, say, as a population, say we're done, that's going to be a long ways down the road. It's very likely we're going to be dealing with this virus in one way or another until there's a vaccine. Certainly it's not going to look like we're dealing with it right now. I can't foresee maintaining this level of social distancing strategies. We're going to have to make efforts to open things up, and our numbers are looking that we're going to be able to support that, cautiously optimistic. But what things are going to look like in a number of months, it's difficult to say. We're not going to be back to pre-COVID days for the foreseeable future, but we're sure not going to look as tight as this.
From CBC Manitoba, Bart.
Barbecues at CBC Manitoba. Mr. Siragusa, rural paramedics say they've been told to stop using protective gear that's the same as protective gear that City of Winnipeg paramedics use. They say that they've been threatened with discipline. They've actually showed me the letter. Why have rural paramedics been told not to use protective purchases that they've purchased on their own?
I haven't actually seen the letter, Bartley, so I can't respond to the specifics. But we would certainly want all our paramedics to have PPE available to them.
Okay. We've asked several times the last couple of weeks about the home care workers that go between several homes. You say you're trying to limit that. When will that practice be ended completely?
Sorry, what was the question? When will it be?
When will the practice of allowing a single home care worker to visit multiple care homes be ended completely?
We are going to be working on that as fast as we can. And the conversations are just happening now with the unions and the agencies, private agencies. So we will have a better understanding of the timelines next week, hopefully early next week, and we'll be able to report specific timelines, but sooner rather than later is our goal.
Thank you to our reporters online. We have a few moments left for this session, so if anyone has a follow-up question or two to the follow-up, please proceed.
I do. Hi, it's Carol at the Free Press. I do have a question. Dr. Roussin, if our R0 number is 2.6 now, with so few cases over the recent days, what was our R0 number 3 weeks ago?
Oh yeah, so this is what I was talking about, that it's a theoretical number. So R0 is the original R number. So that's what we would have seen at the beginning. What our number would be now would be, sometimes referred to as RT or RE, the effective reproductive rate. So what it is right now, it's difficult to know what to calculate what your R value is just by looking at some of these numbers. So the R0 for coronavirus is thought to be about 2.5, 2.6. That's a number we used in our modeling. What our RT is right now, it's difficult to know. What we do know is our secondary attack rate is 9%.
we throwing open mic, but we keep it serious, CBC. Dr. Roussin, are you familiar with the serological research that's come out of California that shows a lot more people, like 50 to 80 times the populace was exposed to COVID-19 than they think, but it's a good news because the death rate's not reflecting that. Are you familiar with some of this research?
This is pretty typical of what we see when we do serologic studies, these seroprevalence studies of any infection, that the detected cases are a subset of those that are actually symptomatic, and those that are actually symptomatic are usually a subset of those who may have been infected but not show any symptoms. And so we find that in most infections, when we do these seroprevalence studies, we find many more people were exposed to the virus than presented to care. And so it doesn't surprise me to see that, and it's very likely what we'll find here as well.
Thank you. About Robertson at the Sun, I want to go back for a moment to the woman who unfortunately died in Prairie Mountain Health. She was the first one who was not in ICU. She was hospitalized. Could you tell me what would have happened after she had died? Would there have been extra steps taken with those who are currently on the ward, extra testing or other precautions?
There's a number of infection prevention and control practices that are in place in the hospital. And just like anywhere else, whenever a person is diagnosed, then a thorough contact investigation starts, and that would include healthcare workers. It would include if there was any other patients that may have been close contacts, and that would have been all followed up on.
But they're not kept separate on the ward, the person who has COVID?
Yes, if when a person is diagnosed, they're certainly appropriately isolated.
Do you know if she was?
Again, comment on the individual. It will depend on when they're diagnosed and a number of factors. So I don't actually have all that information with me.
All right, thank you.
Hello, Dr. Roussin. It's Mohamed from Radio Canada. I was wondering if you have any, if you know if there's any advance on the research on hydroxychloroquine. I don't know if I say it well, in Manitoba.
Right. So hydroxychloroquine. And so that study is ongoing. I don't know how many people are enrolled at this point. I believe there's a number of studies worldwide looking at hydroxychloroquine, looking at a number of other drugs. So as of yet, there hasn't been a proven effective therapy for COVID-19. And so again, cautiously optimistic that we can find something. If we can find a pharmaceutical intervention, and that's going to further enhance our ability to loosen some of these non-pharmaceutical interventions that we're doing right now. So we're keeping close tabs on all those studies.
Thank you.
Dr. Roussin,
Dr. Roussin, Scott Billick from Winnipeg Sun here. Just had a question. So, and this is far off in the future, but like if a vaccine does become available at some point, how quickly would a province be able to kind of administrate that, and would it start with in stages, or how would that process kind of play out?
Yeah, a lot of that will depend on how much vaccine is available and the timing of it. So almost always, just like with H1N1 of 2009, we'll typically roll it out to those that are most likely to have severe complications or those who are most likely to be infected, and we'd roll it out in that manner. That's pretty much a typical manner in which we would do that. So it depends on access to it and what the vaccine qualities are like. So it's really speculation at this point.
And would everybody need it eventually?
Again, it really depends on those findings of these serologic studies. It depends on if we see this virus changing over time. So we know the flu, we need a vaccine every year because the flu virus changes its configuration a lot. We don't know if this virus will do that. So people who may already been immune, that may confer long-term immunity. So a lot of things we don't know right now. So it's tough for me to say that.
Thank you.
Dr. Roussin, Barbara Keevis here at CBC. On Monday, you said that Tuesday you'd start planning work on serological studies in Manitoba. What does that work involve, especially since Health Canada hasn't approved a specific test yet?
Yeah, it would be still in the research stages. So there's some kits available. It's going to be really looking at validating that right now. So routine serologic testing isn't going to be done. We're not going to be able to really apply any results to an individual or even a population right now. It's really early on. It's at the research stage. So we're probably weeks away from being able to perform serologic testing at an individual level here.
What are you using in your research right now?
Sorry?
Which tests are you using in your research right now?
Well, I'm not involved in the research. The lab, I believe, has received some kits. I don't know the specifics of it, and so it's really just early on. It's validating these type of things. We're not doing it at a wide scale right now, but so really we're looking at weeks before we have something in place here.
Dr. Roussin, about the orders issued yesterday that take effect today concerning the North. Do you know what's happening with Highway 6 just before the 53rd parallel? If there's any efforts to stop cars or check cars, or if there's any kind of enforcement at all going on up there?
Well, it's a thing that we're going to start, that we're definitely looking at. We don't have anything specifically in place right now, but that's certainly an option with it. We wanted to ensure the orders were in place. We want to ensure that the message is out, that even though we have some numbers here that are making us cautiously optimistic, certainly our battle's not done, and we have to protect those most at risk, and certainly the remote isolated communities are among those. So we have that order in place now. How it's going to be enforced is still, we're still working on it.
Dr. Roussin, it's Steve Lambert from the Canadian Press. I'm wondering if you can comment on I want to clarify something about the ban on northern travel. If I live in, say, The Pas or Flin Flon, and I'm in Toronto, I fly back home, but I stop in Winnipeg, I'm required to self-isolate. Do I have to self-isolate in Winnipeg, or can I continue to my home community in the north and self-isolate there?
Mm-hmm. Yeah, so it's a good question. So typically with the travel, even with the some of the international travel, it's you're usually allowed to go to your final destination. And so if you were a resident of the north, then certainly the order that we issued yesterday doesn't apply to you. But really, I think the biggest message to your question is that this kind of non-essential travel shouldn't really be taking place right now. So we don't want to see many of these type of this type of travel occurring, where we risk reintroducing that virus into Manitoba. Certainly, the risk of introducing it into northern communities. So my biggest message is I'd strongly discourage that type of travel right now.
All right, we have time for one final question.
Diana from CJRB. Dr. Roussin, yesterday you mentioned that the public health investigation into the death of the woman from Prairie Mountain Health Region was ongoing. Is that still continuing, or is there any update right now?
Yeah, I don't have an update. That would still certainly the important aspects of that public health investigation, such as the contact investigation, is certainly would have been started immediately. I don't know exactly if they are fully completed with that. But things of looking at the where it was acquired, that often takes more time to delve into.
All right, thank you very much, and that concludes today's media briefing.
Thanks.
Thank you.